Now, this is a diagnosis, again, in kids that the kids don't want to have, the parents don't want them to have it, even though the prognosis is good. But how do you explain FND to patients in a way that they will accept it and buy into the treatment?
I think your attitude is probably amongst the most important things. And, I think many of us have worked in settings where you can kind of tell or feel what a clinician is kind of saying with the undertones or without, non-verbally. And so I think sincerity matters. And even if it feels like, oh, a spinal cord injury that structurally damages your ability to walk is more serious and deserving of compassion than, the functional version. Even if we hold biases like this, I think it's important to try to just meet the patient where they are, and they are probably really suffering. Even if this, maybe if we get to their cause, is a big biopsychosocial and the emotional part has a piece of it. Like they're probably really suffering because they can't walk, and or they're really suffering, and that's what kind of got them there in the first place. So um, maybe that's like number 1 through 5 is like kind of try to bring just some patience with this patient population to the table. Um, beyond that, I think is talking about it like it's serious. This isn't not a stroke. This is FND, right? This really is affecting you right now. And I'll usually say that to say like this is a serious condition. Like many people can get better from it. Some people can get all the way better from it. But if you don't do anything about it, we don't know. You might not get better. So this is a pretty, this is a significant diagnosis. Um, and then, I think there's a lot of different, again, rhetoric out there about how to explain it. I find F&D, I've been doing this for like 10 years and you're like, what's F&D? I still find it hard to like explain it, but like, this is a big part of my job. But there's some like cheat sheets where, people use the jargon of, the functioning of the nervous system, versus the structural hardware versus software. Like your computer hardware is okay. It's just the software that's disrupted. So the brain is having a hard time sending signals through that software to the body. We need to reprogram the software. We reprogram the software doing things like rehabilitation exercises, or sometimes we reprogram the software by kind of looking at the whole mind body connection and really get involved with psychotherapy. So I think some of those little pearls can be helpful. And I think then again, giving direction or giving hope to a patient, like you can get better, you just got to do the work. So I think those are some of the main things I put in the package of explaining what. I would also say, some people aren't ready to hear it, and if somebody's really resistant, I might schedule to have them come back again. And if they still want to do a ton more workup and someone else is going to do that workup, great, come meet me when it's done. And it might not be the time as now. Some others, will partially buy into it, but not fully. But maybe they'll do a course of rehab, or maybe they'll even start working with a psychotherapist. And, maybe it takes months and months and months before we can really talk about what FND is. But before that, we're just kind of trying to treat it.